Okay, so let's get into it. Let's go over the muscles of the back. And there are layers, just like with any other aspect of the body. And there's the extrinsic layer and the intrinsic layer. The extrinsic layer is broken down into the superficial and the intermediate layer. So if we go and take a look at the model, the superficial layer of the extrinsic back muscles, we can see right here, and it actually looks like this in a real human body. We can see your big trapezius muscle here, and typically we classify this as upper trap, that mid trap and lower trap region. And you can see it has a very broad kind of shape that all attach to your clavicle and your spine of your scap and into your thoracic vertebrae here. So you can see that depending what angle and what movements you're doing in the shoulder girdle, that determines what part or how this plays together in a functional role to control that scap stability and also to create movement in the scapula itself. So these are your traps, right? So let's hide these, and that is actually underneath your subcutaneous layer of fat. That is the most superficial muscle that you see here. And the other thing that I want to make mention is that the traps, it's relatively thin. It's not as thick and beefy as you would think. It just has a large cross-sectional area because of how big of a surface it spans across. But the muscle thickness itself, it's not as thick as you would intuitively think for how much force it can produce. And when we think about like shrugging or pulling your shoulder blades back, it's not as thick, especially in this kind of inferior region of the muscle. So that is your traps. Then right underneath kind of that distal portion of your traps, we start to see your lats, and your lats is this big fan-shaped muscle right here. And remember, it connects from like thoracolumbar region, lumbar vertebrae region, and it goes all the way up to insert on your humerus. So it has action across the GH joint, across the glenohumeral joint, and it's one of those big muscles that we use to internally rotate our humerus and also extend our humerus when our arm is in front of us. So that is your latissimus dorsi. So if we hide that here, you can see both sides. Then you're starting to get into the intermediate layer. But before we get to that, there's two more muscles of the superficial layer, and it's your levator scap. So let's zoom in a little bit here. Let's navigate this. So levator scap right here, and it attaches to that superior kind of medial portion above the spine of the scap. And then it connects to the posterior tubercles of the transverse processes of C1 to C4. So it's attaching to your cervical vertebrae. And because of that, it does help to downwardly rotate the scap. It can also help to elevate the scap along with the trapezius muscle. And those are the main actions. If your scap is stable, then yes, it can have some action and contribute to some motion of the cervical spine. But for the most part, we commonly think of it as acting on the scapula itself. So if we hide that, let's get to the other side. We can hide the other. And this is one of those spots too that there's a lot of tension that's held here, typically with forward head position or a lot of compensatory posture in the cervical spine. You'll get a lot of tightness here. So that's usually a trigger point that once you release that, it gives some relief. But really the cause is that forward head position or compensatory neck motion, or even some posture deficits in your shoulder girdle with rounded shoulders and all of the other things that we see with poor posture in the upper body. And then the last muscle to go over in the superficial layer is your rhomboids. So we have rhomboids. You have a rhomboid major and rhomboid minor. So the rhomboid major is this lower portion that's, in this model, it's clearly shown and depicted here, but in reality, it's not a clear-cut line like this. You can tease out some of the fibers and see, the difference between the major and minor, but really in the body, it all blends in together. So this is rhomboid major on the bottom here, and this is rhomboid minor. And what's interesting to note about this, of course, it retracts the scapula, and based off of its line of pull, it may help to downwardly rotate the scapula too. But more importantly, it works to hold our scapula against the thoracic wall, because remember, there's no ligamentous connection between our scapulothoracic joint. It's just all muscles holding our scapula against our rib cage. And from the anatomy train's perspective, it's in that same spiral line as your serratus anterior, which is over here. So serratus anterior, this is kind of blending all into that same fascial layer as your rhomboids. If I bring back your rhomboids, right, you can see that serratus anterior kind of wraps around. I would remove more things, but it wraps around. This is going in between your scapula and the ribs, and then it attaches to the medial portion of your scapula. And then from there, your rhomboids attach to the medial surface of your scapula and kind of takes over. This whole spiral line sling, that's very crucial for shoulder girdle function, but also shoulder blade stability or scapular stability. So that's kind of the significance there. So let's remove these again. And then now we are in the intermediate layer. So the intermediate layer, what's interesting is that we have these small muscles called your serratus posterior superior and serratus posterior inferior. So this is the superior portion and this is the inferior portion. Now this is mistakenly very beefy and thick because commonly in cadavers, these muscles are like paper thin. And even for those that it is a little bit more developed, it's very small muscles. So it's not like its counterpart, the serratus anterior. These are very small and thin muscles. Because of that, its function is not really known. But whenever we think about muscles that do not have a lot of cross-sectional area or they're not large force-producing muscles, they do have a purpose. And remember, muscles are a sensory organ too. It can contribute a lot to somatosensory feedback back to the brain. So serratus posterior is one of those muscles because it's so thin. It's thought to have a proprioceptive input, whether that's with breathing function or rib cage movement and expansion during inhale and exhaling. So there is a function there. It's just not thought to be a big force contributing muscle. So that is your intermediate layer. So let's remove that. And that is all of the extrinsic back muscles. So now we're moving on to intrinsic back muscles. And this has 3 layers. This has the superficial layer, the intermediate layer, and the deep layer. So the superficial layer is just your splenius muscles. And if we look at that here, you have your splenius capitis and your splenius cervicis. So right here is your splenius capitis. It's going to attach to the base of the skull. And underneath here is going to be your splenius cervicis. Actually, let's take away SCM, sternocleidomastoid, so you have a better view. So this is splenius capitis. And then you're going to see splenius cervicis is attaching to the transverse processes of the cervical spine. And it's attaching about that C1 through C4. So you can see these are the 2 muscles here. And then on this side as well, let's just remove or hide these 2, splenius capitis, splenius cervicis. So that is part of your superficial layer. Then the intermediate layer, that is your erector spinae muscles. And they function as a group, as a large and strong back extensor muscle. And you have 3 muscles that make up your erector spinae group. And the way that I've learned the acronym is ILS, from lateral to medial. And the acronym is I love spaghetti. And the other way that you can remember it too is if you know the lateral group, which is iliocostalis, it connects, as the name says, it connects to the ribs. So this is your iliocostalis right here. It's going to connect into the ribs itself. So let's hide that group. And you can see it on the left side here too. This is also the thoracic portion of your iliocostalis, so let's hide those as well. Then you can clearly see longissimus is right here, right medial to that. So let's hide longissimus on the right side and the left side. And then the most medial muscle is your spinalis. And just like the muscle would imply, it's sitting right on top of your spine. So this is your spinalis right here. So let's hide that. Let's hide that. And that is your erector spinae group. Now keep in mind, you do have regions of all of these erector spinae muscles. You have the lumborum region, the thoracic region, and the cervicis region. So that's what you kind of see up here that I didn't hide some of these is you see the cervicis region here, right? But collectively you can see how they're going to be very strong extensors of the spine. So this is what is helping us to extend our spine, keep ourselves upright against gravity, and do all of the things that require extension. Extension against resistance, but also to hold our body upright to withstand or counteract the forces of gravity. All right, and now we are on to the deep layer. So the deep layer, we have all of these small muscles, and they're technically grouped together to characterize kind of what they do. And the first grouping is your transversal spinalis muscles. And this is located in the gutter between your transverse process and your spinous process. You really have all of these muscles that are spanning across different amounts of segments, vertebral segments, and they are providing a lot of segmental motion and stability support, but more importantly, a lot of proprioception and somatosensory feedback, especially when our spine is moving in all of the degrees of freedom that it can move in. So what makes up the transversal spinalis group is three muscles: your semispinalis, your multifidus, and your rotatories. Now this is where all of these muscles in reality really just blend into each other, but they can be differentiated and teased out if you look at how many vertebral segments they're spanning. So typically rotatories, they span across one vertebral segment, and they're attaching from a transverse process to the adjacent spinous process of the segment above. Then you have multifidus or multifidi plural, and this is typically really beefed up in the lumbar area. That's why it's one of those muscles that you hear a lot that, with low back issues, low back dysfunction, the multifidus is something that's lacking. And again, it's probably because of how beefy it is in the lumbar region, but also to provide that somatosensory and proprioceptive feedback when we're actually moving through our lumbar region. So the multifidus spans 2 to 4 vertebrae. And then semispinalis will span typically more than 5 vertebral segments. So if you just kind of think about this, we have a lot of different, almost like guy wire supports to help to stabilize our vertebral body. Because again, yes, we do have ligaments, we do have other passive supports, but because our vertebral body and our spine can move in so many degrees of freedom, we need a lot of dynamic stability in our spine. So this is what you're going to see here. These are your semispinalis just because of the angle, and see how big they're actually spanning, right? Semispinalis, you're gonna find a lot of them in the cervical and thoracic region. So let's hide those two. And this is the cervicis region of semispinalis. I don't know how good this model will be in differentiating the rest. This is your multifidus, which it did not really do a good job with the details, but anyway, you can see that your multifidus is here. And like I said, in the lumbar region, it's very beefy. It's so beefy that you have your mammillary processes of your lumbar vertebrae that is actually developed because of how beefy and the force that the multifidus is pulling on the vertebral body where it attaches. So you have these mammillary processes that form. So anyway, that's your multifidus. So let's hide that. And then underneath here, it doesn't really look like this. It's really hard to tease out in a human body, but you can see that your rotatories, it spans across one vertebral body. And you actually have your rotatories longus and brevis. So actually longus attaches across 2 segments, and brevis attaches across 1 segment. So that is your rotatories. And it's a lot more developed in the thoracic region, which makes sense because our thoracic region permits a lot more rotation in our spine in the transverse plane. So again, if you're going along that concept that it is there to offer somatosensory feedback, proprioceptive feedback, then it would make sense that it's more developed in the area of the spine where we do the most rotation. So let's hide that. Okay, get rid of your rotatories. Okay, and to finish off this deep layer of intrinsic muscles, you have your interspinalis muscle. So exactly what the name implies, it is connecting in between the spinous process of each vertebrae. So this is your interspinalis muscles. So let's hide that. You have it on both sides. Then you have your intertransversari muscles, And these are again small muscles that are in the lumbar and cervical regions. Exactly what the name implies, it is connecting transverse process to transverse process. So you can see here, these are your intertransversari muscles. Let's hide it here. I think this is, yes, this is some of that too. Let's hide this here. Okay, and then the last muscle to finish off this deep layer of intrinsic back muscles are the levator costarum muscles. So it is what is in the name as well. One of its function is to lift or elevate the ribs. So levator costarum referring to ribs. So this is your levator costarum muscles. So you can hide that, and you can hide these. And that is all of the intrinsic back muscles, the different layers. And collectively, a lot of these smaller muscles, I want to reiterate, is their job is not to be large force-producing muscles. A lot of that is done by your erector spinae, but their function is to contribute that somatosensory feedback, that proprioceptive role, because our spine is very mobile. It's meant to move in all of these different directions and coordinate that response with what our limbs and our extremities are doing. So that is the key. It's like an ecosystem of back muscles. Every muscle has its role to contribute to spinal segmental stability, to proprioception, to big gross movements, to helping to support the large agonist muscles to create more and more amounts of force through the spine. So all of that is crucial to make sure that our spine stays healthy and it moves well. So that is the back muscles, and it's very important to know how they work and contribute functionally to our body as a whole.